Creating lifelong patients. It's every chiropractor's dream. Educated patients are compliant patients. This blog is going to give you 3 proven concepts to generate lifelong promoters of your chiropractic practice. For 30 years, research has challenged the assumption that persistent pain reflects the condition of bodily tissue. To treat pain, many patients will visit a chiropractic office. They'll get a massage. They'll watch YouTube videos. They'll take medication, they'll buy gadgets online, or rub expensive oil on themselves. Each therapy has varying degrees of legitimacy and efficacy. When you only treat pain as a part of your narrative in your office, you now compete with every gadget, with every infomercial, with every healthcare provider treating those pain patients. There's a better way. You can use your license to educate patients about why their specific habits, why their comorbid factors, why their sports result in pain. This small shift will separate you from the competition. Here are the 3 concepts evidence-based providers use to create highly engaged patients for life. Concept number 1. Pain is not a signal that originates from bodily tissue. Rather, it's a highly motivating, perceptual experience generated based on perceived need to protect the body from tissue harm. This concept should dominate your initial consultation during the evaluation of a new problem. Pain is a good thing and indicative of a working nervous system. Muscular spasm, joint restrictions, movement compensations are all secondary to the activities they were repetitively engaged in throughout the day. Long-standing pain presentations require a broad focus, not just structural and functional adaptations. Nearly all veteran secretaries have rock-hard upper trapezius. Stretching the muscles, manipulating the joints may not be as powerful as changing the workstation ergonomics. Like novice runners, they need to learn proper training strategies instead of just manual therapy over and over to their shin splints. People and patients are typically better equipped to participate in treatment selection when they understand the proposed mechanistic contributors to their pain. Sometimes you're not going to be the expert on everything that patient needs. That is okay. Build a network of experts in your community to cross-refer those patients in the patient's best interest. Concept number 2. Pain is not a dependable indicator of tissue state. Nociception is subject to up and down regulation at multiple points along the route to the brain. Perception of pain is a product of the nervous system's plasticity, and there's 3 points that we can actually affect this in the periphery, the dorsal horn, and also the brain. Lumbar spondylosis, rotator cuff tears, knee osteoarthritis. All these sound like painful conditions, but they're often not symptomatic. These conditions are merely complications to a healing process indicative of long-standing dysfunction. The patient's treatment strategy should recognize all the potential contributors, which we'll list in concept number 3. We need to make sure we have the right diagnosis instead of just focusing on the symptoms. For example, many painful musculoskeletal diagnoses, the symptoms reduce with exercise. Mechanoreception and activation of the descending inhibitory pathway are cheap, effective, and safe ways to decrease nociception. Here's what I do. I have my patients park in the back of the parking lot, regardless of their diagnosis, for each store they visit. Increasing steps and walking speed are excellent therapies for nearly every musculoskeletal diagnosis. Keep things simple, keep things measurable. Concept number 3. The nervous system's plasticity depends on other bodily systems and functions. Immune function, tissue injury, stress, obesity, exercise, etc. The reversal of sensitization of all the environments represent a viable target for our treatments. This concept is particularly important for the chiropractic profession as we are experts in using movement and patient education to modify these neural pathways with multiple platforms. Treatment of rotator cuff syndrome can include manual therapy, heat, joint manipulation, but it can also include altering their sleep posture, controlling blood sugar, reducing obesity, possible PRP injections, screening for yellow flags, improving posture, etc. How many of these therapeutic interventions or conversations are you willing to engage in to determine your patient's success? There is no secret that healing potential decreases with age. A 3-year-old and a 9-year-old's healing potential, they just don't share the same healing time. Other factors, though, slow down or even stop the healing process. Autoimmune disease, diabetes, thyroid disease, medications, obesity, just to name a few. Don't be afraid to treat each patient as a case study of one and explain how each one of these variables affect their prognosis. Chiropractors must be able to explain through a biopsychosocially informed hypothesis about all the potential contributors to that pain that's experienced by that patient. So in conclusion, my 3 concepts. Your pain is due to a misaligned joint isn't good enough. It never was. Don't be lazy. Evidence-based chiropractors must recognize all the factors leading to pain and educate their patients on the variables that led to that dysfunction. Then, patients can participate in their treatment selection by weighing the advantages and the disadvantages of each treatment option against their expert knowledge of themselves, Google, their medical doctor, and your information. Then, and only then, can we have patient-centered care. I hope you'll check out ChiroUp. I hope you use ChiroUp to its fullest ability. That's what we try to do on a daily basis, every single condition report we put out. If you're not a subscriber, join and check us out. If you are a subscriber, thank you. We'll continue to innovate and we'll continue to make it easy for you to be an evidence-based provider and have a successful practice.